Dr. Kahan, podiatrists make, I call it inserts. You guys call it orthotics and all kinds of names. Talk to us a little bit about the different functions, the different reason why one could have orthotics, when one should start having them as a child, as an old person, and also at the end, shade a little bit of light on orthotics, bought in the store, in a pharmacy store or wherever. Orthotics custom made is sometimes just an orthotics out of the store just as good, or is it at least better than nothing? Just, overall, tell us about orthotics, inserts. Much nicer word for me to pronounce.
Oh my gosh, orthotics. Yeah, I'll tell you. Who needs an orthotic? I'm going to answer that question. Does your car need shocks? Try driving around in a car, or imagine driving around in a car without shock absorbers or struts, as they are in most cars nowadays. Be a pretty bumpy ride, and you'd wear out your tires pretty quick, and your tires would be your whole body that would get worn out fairly quick. So my first answer to the question is, regardless of your age, if an orthotic did nothing else but act as a shock absorber to your body, that in itself would be a fantastic thing. Okay, enough said there. Let's back up. Does everybody need orthotics? To a certain extent, no. When you're a child, you're running around and you're very active, and provided that your family is buying you, well-fit tennis shoes.
They all cost $420. How can they not be well-fit?
Listen, if you're buying your 4, 5, 6-year-old $420 shoes, and I'm opening up a store near town tomorrow, you got me off track. No, okay, so I know where I was going with this. Listen, in a child, their foot is continually developing. It's going to develop. The seeds are already planted in your body's gene map on how your feet are going to be, how your whole body is going to be. So for the most part, for a child, it's probably not as critical. Kids grow up. Most kids have flat feet through 4 or 5 years old. So that's not a big concern unless they're complaining about it. By the time a kid gets to, age 7 or 8, when they're starting to play soccer nowadays, or they're playing soccer, baseball, basketball at young ages, my biggest speech on that is don't push your kid too hard, because he will. He's going to complain about his feet hurt, that his legs hurt, that his knees hurt. And if they just are adamant and just stubborn as heck about, I want to play all those sports, Mom and Dad, if they love it, then you know what? You can see the podiatrist, and he can fit them in not a custom orthotic. There's no reason to pay $300 for a custom orthotic. So in 6 months, when his shoe size goes from a 7 to a 7.5, you got to buy another pair. That'd be great for my bank account, but, we've got to be practical here. And podiatrists are very astute, and we as a group produce or can make a semi-custom orthotic very inexpensively that a child can put in their shoe. And it'll last a year. It'll last probably longer than a custom orthotic, because we can design it, we can make it fit so it fits a few size lengths. And as kids get older, as we get into our teens and so on, and we become more active and our weight increases just because of our body growth, that's the time to think that, okay, that shock absorber theory, that shock absorber analogy, that's where that really becomes important. We get active. Now we're in our 20s, 30s, we're getting older, more active, and so on. And it's really important to preserve our joints, because guess what? Someday we're going to get old. And most people don't think that way. We're not going to think that way. The store-bought orthotic, guess what? For the most part, and there's a couple out there that are very good, but the only place you're going to find a store-bought orthotic that's worthy of anything is a specialty running store. That's it. Forget Walmart. Guess what? Dr. Scholl, he's not a real person. Colonel Sanders is. Dr. Scholl's is not.
I didn't know that.
Yeah. It's not a real person. I'm not sure where he was invented, but Yeah. Anyway, Dr. Scholl is not real. He's never made anything in his life, but a lot of money. So the podiatrist option or the running store option, as far as some kind of an insert, is by far the better bet than your local drugstore or the grocery store, Walmart. I promise you, you're going to spend the same amount of money either place. We're not here to fill our bank accounts. We're here to fill your shoes with comfort. And there's a place for custom, and there's a place for that, quote, over-the-counter, non-custom orthotic. Okay, just got my train of thought back. So, what's the difference between the two? Why would somebody get a custom versus a non-custom? Probably the biggest reason is depending on the activities that you're doing, how much weight distribution. The custom orthotic overall is molded to your foot. It's designed to distribute the weight, make you walk differently, take the strain off your back or your hip, off the front of the foot to the back of the foot, and so on. So there's many conditions that the orthotic will treat, whether it's a heel spur or arch pain, things of that nature.
Since you mentioned that, like, the orthotic is measured, whichever way you guys do that. I think these days you guys have obviously you have the old-fashioned sand mold kind of like, and go in there, then you probably where it's supposed to be. And I think you also have computerized ways of doing all that now. But so let's assume, is it possible that a person goes to a non-custom made in the store, and by doing so actually makes things worse? Because yes, you need an orthotic, but that one actually lifts him or whatever in a wrong place where he's already too high lifted in the first place. Something like, could that happen or not really?
It could. It typically does not. Oftentimes what I'll tell somebody, and the reason I bring up the specialty running stores, because when I get a patient in and unfortunately with this day of insurance problems and the fact that insurance doesn't want to cover anything, I mean, orthotics are not cheap. Let's face it, whether it's $300 to $500 for a custom orthotic, it's not always possible. So in those situations, I'll tell the patient, listen, go to such and such specialty running store, pick up this exact orthotic. It's going to help you. This is going to be a good indicator of whether that $300 device is going to really just be the icing on the cake or not. If the orthotic that I put you in that's only going to cost you $40 or $50 is not going to do the trick, guess what? There's probably a good chance that spending $250 or $300 more may not be the right option as well. And we need to kind of look in a different direction.
Yes.
And say, hey, well, maybe this.
Yeah.
So another thing, what I'm saying is it's not always appropriate.
I got it. So that's very, very interesting and very, very good to know that, like, if you start off with not necessarily the cheapest, completely useless type of stuff, and you go that, already to those custom stores and they have a better one, if it doesn't do anything, there's a slight chance that the custom one might not either. And so it's very good to stay in coordination with the doctor, because you probably know which one of the brands out there have a chance of succeeding, instead of us trying again 6 brands, and by that time we're up to $300 custom already anyway. Do you know what I mean? However, give us a few more hints here of what are some of the symptoms as patients are having which potentially could be cured with a orthotic.
Well, multitude of problems. Almost any type of arch or heel pain. If you have a child, that's in the 7, 8, 9, 10, 11, 12 range, let's say, they complain of their ankles or their feet being tired. A lot of times that is an indication of a flat foot. And if you really want to tell how flat their feet is, take them in the backyard, have them step in a puddle of water, and step on a flat ground. And if you see the entire outline of their foot, they've got pretty flat feet. You can look anyway and obviously tell, but it's more fun to do it that way. That way the child can kind of look and see what the problem is also. But any type of fatigue, foot fatigue, ankle fatigue, arch pain, heel pain, ankle discomfort on either the inside of the ankle, the outside of the ankle, after activities, or getting out of bed in the morning and you have heel or arch pain, or even just achiness. These are all small signs that, guess what? The day before, maybe I did too much. And with the proper orthotic insert, I may be able to alleviate some of these problems.
What about cramps? Like, leg cramps? Yes, no, not really? Could be?
There was kind of a technical error there, and the camera went a little fuzzy. Can you repeat that, please?
What about?
I heard cramps, and that was the end.
What about leg cramps? Could they be an indicator you need orthotics? Not really, maybe, perhaps?
I'd probably say not likely. Leg cramps are usually a function of dehydration and or possibly being over-medicated with other medications that maybe an older person might be on, whether it's a blood pressure medicine or a water pill that's
all right.